South Korea has temporarily allowed medical professionals to diagnose and treat patients from a distance using telecommunications technology. Virtual healthcare has since boomed here in the nation. Shi-hoo sheds light on this phenomenon.
When 28-year-old Kim Hee-kyung needs a medical consultation, she doesn't need to take time out of her day to visit a doctor. All she needs to do is to reach for her tablet and launch a mobile application. She puts in her personal info, selects her symptoms, and voila! Within minutes, she's face-to-face with the doctor in the comfort of her home.
안녕하세요.
네, 안녕하세요, 선생님.
어디가 불편하셔서
After the virtual consultation, the doctor makes a diagnosis and writes a prescription that is delivered to her home. With the spread of COVID-19, the South Korean government has temporarily allowed healthcare professionals to evaluate, diagnose, and treat patients from a distance using telecommunications technology. Since being legally permitted, the number of patients who have availed of the service has grown significantly.
Among the perks of telemedicine is that patients can see doctors and receive prescriptions quicker than they would during a traditional visit to a clinic. Through telemedicine, patients suffering from COVID-19 are receiving prescriptions quickly.
But its perks are not limited during the pandemic. Here at Inha University Hospital, telemedicine is offered to Koreans overseas and foreigners in South Korea who may not be able to access the care they need where they are. The doctor checks the condition of the patient located overseas as she would in an offline consultation during a conference call.
We began offering telemedicine to Koreans overseas as medical care can be less accessible and patients can experience cultural or language barriers during their care.
That's not to say there aren't limitations to this practice. There are initial costs associated with the technology, both for doctors and patients, and some are concerned that virtual medical examination may not be as effective.
I expect the advancement of medical technology and the development of digital healthcare will help alleviate current limitations.
Legal experts say changes must be made to the current law to allow telemedicine to be practiced permanently.
No countries outside of South Korea ban telemedicine entirely. South Korea needs to take a more open stance towards telemedicine and make the necessary reform to its medical law.
Shi-hoo, Arirang News.